Robotic surgery is surgery that's performed with the assistance of a surgical robot. The surgical robot is a tool that assists surgeons in performing an operation with more dexterity and with better visualization. Some of the benefits of robotic surgery are that the surgeon has three-dimensional vision while they're working, which is something you don't have with laparoscopy. There's also increased dexterity because you have a wrist on the surgical instruments that allow you to be more dexterous. The procedures that I perform robotically are cancer on the left side of the colon and rectal cancer low in the pelvis. I think the major advantage for colorectal surgery robotically is the improved visualization and the improved dexterity. It can be very difficult, especially operating on men who have a smaller pelvis or people who are overweight and doing the surgery laparoscopically. So I think for those patients, the robot gives me a huge advantage to stay laparoscopically or stay robotically, not have to make a bigger incision. So I think for a select group of patients, the robot definitely improves their surgical options, especially with rectal cancer surgery. I think one of the advantages for robotic surgery for patients is there can be less blood loss while they're in the operating room. And also there's a lower chance of having to make a bigger incision to get a tumor out. The better visualization and the dexterity with the robot can allow the surgeon to do the whole surgery robotically and avoid having to make a bigger incision. The patient may then have less pain after surgery and even be able to go home quicker. As a colorectal surgeon, I think the robot has a couple advantages for me as a surgeon. The visualization is much better. I have a depth of field, so I think I can see the anatomy better. And there are a few ways to see structures like the ureters and the blood vessels better than I could see with the naked eye. Patients do have a choice about whether the procedure would be done robotically or minimally invasive laparoscopically or open in the standard fashion. And with each patient I discuss with them the risks and benefits of each one, and together we make a decision about the operation that would be best for that patient. While Wyoming Medical Center has had the surgical robot for some time, and patients have been able to get surgery from gynecologists or urologists robotically in the past, this will be the first time that patients will be able to get colorectal surgery here at Wyoming Medical Center.